Okay, that's a common notion which we follow. See, when we talk about artificial intelligence, there are a lot of definitions available in for artificial intelligence. The one which I read, I still remember what I read during my UG days, that is more than 20, 22, 23 years back. We followed Elaine Rich as a textbook, and artificial intelligence is a branch of study where computers tend to do the job which at present human beings do better. I still remember the definition. Don't ask me anything beyond this. I only remember the definition. So that is one definition which was given to us by Elaine Rich. There are different versions of artificial intelligence. You can probably you can come across the famous formulae which was given by Tom Mitchell for machine learning, as well Peter Norvig, Stuart Russell. They all have different versions or different definitions, and Wikipedia, each and every company, all those things, all these famous personalities, they have all come up with different definitions for AI. I leave it to you. However, we call artificial intelligence is a branch of study where we try to see how can we make the machine to take decisions like human being based on the data fed to it. Okay, I would like to keep it in a very simple way. Machine learning is a subset of AI where we very richly use data and algorithms to imitate the way in which the human beings learn. See, even though we talk about this, we are all in the mid of this prolific infiltration of OpenAI. Generally, it's called generative AI. I call it as OpenAI. I'm not mentioning the company name. I'm generally talking about the open system, open AI, which is available in the market today. So we are in a situation where I hope all of you would have heard about AI agents. So the next big thing, what they are predicting is AI agents. If you are not following news or newspaper, please understand Starlink is going to be the important keyword which will be there in around at least for next 5 years or 4 years. That is, the US government has officially has gone into link with 3 companies, and they have a huge plan to bring AI to human beings. They wanted to bring AI to day-to-day life of human beings. That's going to happen in a very big way. Whenever the West embraces something, it will also spread across all other nations, and soon India also will be looking to place themselves safe, and they wanted to be the focal point for AI emergence. In addition to that, Tamil Nadu government has also announced a AI corridor in Coimbatore. Hopefully, if you are aware, they have separately announced IT, like IT park. They are coming up with the AI park for companies hailing from the vertical of AI, which will be hosted in Coimbatore. So what I'm trying to say is, we are not only going to talk about something which is happening somewhere in the globe. No, I'm trying to pinpoint and I'm trying to emphasize what is happening around us. Where are we? What are going to be the opportunities? Believe me, my dear friends, personalized AI will be the future in form of AI agents. And we don't know what's stored for us. Okay. Being a cybersecurity enthusiast, there are a lot of security leakage which also needs due attention. Hopefully, we will evolve. I hope that we will evolve as and when we start embracing the technology. Evolution of AI in healthcare. See, if you start at AI, you can see here historical milestones. Whoever talks about AI in healthcare, the first terminology which they cannot omit is IBM Watson for oncology, Google's DeepMind. See, the IBM Watson for oncology, from the name itself, you can understand. IBM developed a Watson engine which could get the data, process, and it could give you some output, right? So they developed IBM Watson for analyzing the images or data pertaining to oncology, and they also tested it with very good established established hospitals and healthcare institutions available across the globe. The second one, DeepMind, was used for predicting the patient's deterioration. That is, it also takes care what is the emotion which a patient undergoes when he is in a different phase of his treatment. For say, whether in diagnosis or in, I mean, whether in the identification stage or in a diagnosis or stage or in a recovery stage, what kind of emotions does a patient goes through. That was very well read by Google DeepMind. And recent technological advancement includes the neural network. That's what I said. And when I say neural network, NLP comes into picture, advanced computer vision, contributing to the efficiency and sophistication of healthcare solutions. See, today we have come to a stage where, if I want to say one classical example, it, 1 year or 2 year back, there was one use case where a patient from US was saved because of his Apple Watch. The Apple Watch measured, I mean, you all know, the smartwatches measured the physiological parameter of human being. It was talented enough that it realized some mismatch in his heartbeat and different bumping level of his pressure. Immediately, it dialed the nearby emergency healthcare unit, and the ambulance came and they were able to take him to the hospital on right time, and his life was saved. So, good technological implementation could even result in saving a human life. That was one case which we came across. There is another classical example. If you take Japan, you all know, Japan is known for, known for tsunamis, right? Tsunamis, and because for them it's more like it's that part of life. It's more like in Chennai, we all know what happens to us in November and December. We will be seeing the rain with the kind of fear, right? Likewise, we now see it all happened, started happening in way back, decade back, and now we got used to it. If there is a forecast, we prepare ourselves how to face it. Likewise, in Japan, tsunamis are very common thing. What happened was, on one day, the Japan government got some data from Twitter that the most of the people in that city has woke up very early. When I say very, very early, for example, you imagine that all the people in that will see, you all know, once we wake up, we go to the mobile phone. So there was some extraordinary situation where most of the people have hit the Twitter in the early morning, which was abnormal. So what happened? Twitter immediately informed the Japanese government, and they were able to send the rescue force, and they were able to minimize the damage. So I know it's not, all the examples what I'm giving here is not happening only through AI, but you have to keep one thing in mind. It's all the era of integration. When I say AI cannot act alone. It has to depend on different devices from which it is going to get the data, and it also depends on the cloud platforms or the database where the data need to be stored, and it depends on, ultimately the front end will be the algorithm, the machine learning algorithms which will come into a role. They will play their pivotal role in calculating or predicting what could be the cause or what could be the damage it could be caused. So coming back to the example, again, you all know there was a Ebola virus which was spreading across the globe. The Ebola virus spread was very easily found by Google search. Okay, so what happened? Google collected the data of people who tend to go and search. See, it's very quite common, right? Whenever we face any COVID, most of the searches across the globe would have been about COVID. Likewise, Ebola, they were able to find what are the places where the more number of people look about or search about Ebola, because obviously it's an indicator that in that location, virus virus would have got outburst, and likely what they did, they were able to inform or warn the government upfront so that government could take timely actions. Okay, this is what I'm trying to say here. I hope I'm able to convince you by giving you the technical examples or the technical use cases where technology plays a very pivotal role. Okay, not only AI, other technologies also combined together. The another one, enhancing the diagnostic accuracy. See, even let's assume that we have a image processing unit. By feeding the images, it should be able to predict whether a patient is affected by a cancer or not. In this case, usually in algorithmic world, we tend to say that I have got 98% of accuracy. When I say I have got 98% of accuracy, it's always a good result. Do you agree with me? Because 98 or 99 is a very good result, pretty good result. That shows that the quality of data, the quality of algorithm, what we have used has yielded a good result. But imagine in this kind of medical diagnosis, even in oncology prediction, if it delivers 98%, on paper it's good. I'm not here to confront with that. But imagine what about that 2%? If the false positive rate is 2%, what will happen to the people whom we have diagnosed as cancer, but they were not really suffering from the cancer? So that's the place where the machine learning algorithms comes into picture, or deep learning algorithm comes into picture. And I do agree, we have a long way to go. We are still working on it. As and when we keep on feeding the data to the system, we will have a good maturity. But what happens here is, you imagine another scenario where if a diagnosis happens, or if we are able to diagnose again, I take this oncology example. If we are able to diagnose a cancer in the very early stage, then you all know, medically, if you are able to diagnose a patient at the early stage, the chances of recovery, for that matter, any disease, the chances of recovery will be very high. So this AI could play a very champion role in diagnostic accuracy. Then personalizing patient care. So now we have come to a stage where personalization is happening. You all would have heard about Industry 4.0. Industry 4.0 was all about digitalization, wherein the Industry 5.0 is all about personalization. So healthcare is also not an exception. Industry 5.0, when I talk about Industry 5.0, with respect to healthcare industry, it's all about personalization. What I'm trying to say here about personalization is, a medicine could behave in a different manner for different individuals, right? It's very quite common. It could be the case where a same tablet may give good result for a person X in 3 days, wherein the same tablet can give good result for a person B in 2 days. So we have to understand the personalized physiological or other parameters, biological parameters of a human being, so that even the drug prescription could vary between one person to another person. So all these things will result in more effective and customized healthcare. Okay, that is what we are talking about, and soon we are moving towards that. Okay. So what are the current trends? Anyhow, the current trends I will also cover at the last, but now, what are the current trends? This is what, again, image recognition and analysis, predictive analytics. Image recognition technology aids in the accurate analysis of medical images, enabling early and precise disease diagnosis, which leads to better patient outcomes. Okay, what is that image recognition and analysis? You all know that to country like India, we don't even bother to take scans or x-rays or whatever it is, right? At least in the other side of the world, they have little innovation towards taking scans. But here we don't mind. Whenever a doctor prescribes, we go and take for a scan. So what are we going to do with those images? How are we going to make result out of that? The people who have already worked with the Kaggle data set, you would have understood the images available for a particular disease or for a particular healthcare use case is pretty low. We are in a scenario where we need to start a campaign among the people to contribute data to this kind of activity or this kind of research. For that matter, even there are few companies, or there are few calls where they even ask you to donate your DNA. Okay, so it's more like donating for the social cause, and it's more like donating for the betterment of the next generation. I do agree. By donating our DNA, sometimes it may also be useful for us, but otherwise, when it becomes a part of a bigger research, it could also help the future generation to be foolproof for certain diseases. Okay, so image recognition and analysis play a very, very vital role in these kind of medical applications. And we believe that image recognition will play a center point or a focal point in helping us in diagnosing the diseases in the earlier stage. Predictive analytics. It talks about the historical data. How can we do, what can we do with the historical data? And how can we improve the preventive care? Okay, see, the preventive care is a very, very important phenomena in healthcare. We may talk about diagnosis, we may talk about treatment, we can talk about recovery. That is setting it apart. The preventive care is picking up. No, the people have got more awareness. They want to prevent the disease. How can you do with that historical data? See, take a simple example. Any smartphone which is more than 5,000 rupees can track how many steps you have walked on that day. It can track how well you have slept on the previous night. It can even track what was the food intake which you had on a particular given day. It can track whether you have fallen down on that particular given day or not. And you can also trace what was your emotion, what were you going through, right? You can track that. Imagine if we can combine the data from our smartwatch and mobile phone, and if we can consolidate and validate and put them into a repository, imagine what are the outcomes we can predict for an individual person. Now, you can also relate to what I was talking in the previous slide. I was talking about personalized medication. So this predictive analytics could also be a player which could enable the personalized medical care. So these are all simple examples. I'm not even talking about huge devices. I'm not talking about, there are devices in the market. It will be in the size of your mobile phone. They have the capability to take ECG. Okay, they have the capability to take ECG. And for your information, there are medical devices available in the market which could capture 32 physiological, biological, psychological parameters of a human being, and it can feed into the cloud. So whatever I'm saying now is not something which I'm talking about the future. I'm talking about not even present. I'm talking about the past. So that is the scenario of technological disruption happening in the healthcare industry. Any doubts here? Shall I proceed? Chat. Okay. Okay, I assume that you don't have a doubt. I'm proceeding. Personalized medicine. What do you mean by personalized medicine? I touched upon this also in the previous example. Tailor-made treatments based on individual genetic profiles and medical history. A person with the disease A, but with a different medical history. A person with I'll take a very commonest example. A person with the disease A plus diabetics, person with disease B minus diabetics. Are we going to treat them in the same way? Imagine if we are able to understand the genetic structure of our human body. You all know, you would have heard this, you would have heard this. This is a genetical problem, or this disease comes to you through genes. This is a family disease. That's what they also say about diabetics, right? Diabetics, they say how aware you are, how caution you are, you may be exposed to diabetics in case if you have a family history, right? You would have heard about it. So personalized medicine. Can we tailor-made personalized medicine based on our genetic structure? That is a very interesting question which we need to look at. So that is what is advocated in personalized medicine. If I want to give you another classical example, in oncological treatment, you all would have heard about this chemotherapy, right? So the chemotherapy doesn't work in the same way for all individuals who are affected by the cancer. So we can find out what dosage of chemotherapy should be given to a patient depending on his recovery or depending on his further diagnosis. That could also be a very vital personalized medicine which we can think of. And the another important thing you would have all seen in the newspapers, very commonly you would have seen in this newspaper about robotics in surgery. So the robotics in surgery enhances precision and control during operations. See, whenever we create a robots, yes, robots are good at performing the monotonous task, no doubt about it. So you could also think of using this robotic surgery as a tool where whenever you want to do a monotonous surgery or wherever you feel like it need to be consistent, you can think of using this robotic surgery. So the robotic surgery not only gives you the consistency or the error-free surgery. See, by this, don't mistake me. I'm not trying to say that human beings tend to commit mistake. What I mean to say is when there are minor surgeries which could be very well handled by robotics. Okay. And they say recovery time is also so quick whenever we undergo robotic surgery. Because naturally, most of the robotic surgeries will use minimal invasive methods, right? You would have heard like the laparoscopic way of treating a patient rather than opening his body, or can we inject something into his body and see to that that capsule goes and does the job instead of opening up, peeling his, I mean, opening up or I mean, cutting his skin. So these are all few steps which are few advantages which we enjoy by using a robotic surgery. Wearable technology. I mean, today I think my next speaker will be completely focusing on wearable technology. Wearable technology, believe me, my dear friends, it has hit a skyrocketing and it is happening today. Wearable technology is in different level. 3D, 3D based body parts. Okay, if possible, I'll show you at the end. I have another presentation which I did before 3-4 years. You could see like artificial hand or artificial leg were made, and even we have come to a stage where they try to get tattoos in those artificial limbs. So 3D, all those things are making huge buzz in the market as well. Wearable technology. When we say wearable technology, it could be a glass. Google Glass came, Microsoft HoloLens, all those things. See, Google Lens, they even did a surgery by using Google Glass. Okay, that is a veteran doctor was residing in one part of the country. His junior was doing a surgery which was supervised by him by using the Google Glass. This happened. This happened way back. I'm talking about 5-6 years back itself. So wearable technology is leading us to a different horizon. It may, I don't know, probably tomorrow we will be all wearing a shirt which will be having a picture or which will have a TV screen on it. You may see your next IPL match in your shirt itself. You need not to go to any other place. So to that extent, wearable technology is improving. I need not to say about the cliche wearable technologies like your shoes, your ring, your I mean, what is that? Palm ring. I mean your smartwatches, your necklaces, your jewels, your dress. All these things comes under the category of wearable technology. See, wearable technology could be used in two places where we already discussed. One, it could be a good tool to analyze or understand how a patient is recovering. That is one part. Second, very important part, as we all know, it could also be used to capture the data to perform some preventive cares, to perform some preventive, take some preventive actions which could which could help a patient to keep, which could help a human being to keep themselves away from certain diseases. Okay. And remote monitoring concepts. Imagine there is a ICU, CCU, critical care units, intensive care units available or part of each and every hospital networks here. It becomes very tedious for human beings to sit there and monitor all the vital parameters for 24/7. You know, the lacuna in monitoring the vital parameters in ICU or CCU could end up in a human life. So what is the alternate? Can we come up with the telemedicine concept or not telemedicine, the remote patient monitoring concept, where we try to collect the data or we try to check the vital parameters of a patient who are in a critical stage wherever we move across the city. For example, I'm talking about 2017. I visited a private hospital in Chennai, and I was talking to the cardiology head, and I asked him like, how is he able to monitor the vital parameters of the patients whom he is taking care? He opened an app and showed me that there are systems in place where he is able to take care of the important observations about such critical patients through his phone. Whenever he opens that, he said like every 30 minutes he will open and see whether their vitals are proper or not, whether their vitals are normal or not. So like this, remote patient monitoring could play a very, very vital role. Even imagine a very pandemic situation where we need to have a lesser human intervention. How can we take care of the patients? It could be very well monitored. It could be very well handled by using a remote concept. Applications, you can see here, the clinical applications where we can use AI and MLR. They enhance early disease detection by analyzing medical imaging and genetic data. Treatment recommendations. That's what we already discussed. What could be the treatment model? Machine learning models play a very vital role in making our bringing the personalized medicine into reality. The patient-specific data, and which could ultimately end up in improving the treatment success rates. Drug discovery and development. See, this could also be used in the other way. Whenever they find one set of people are being getting relieved or getting cured in a pattern of a medicine which was prescribed to them, that could also lead to a discovery of a new drug, right? So that could also happen in the flip side of what we are talking about, the personalized medicine or predictive medicinal approaches. Any doubts here? Okay, next, how they play an important role in hospital management and resource optimization. When I say about hospital management, I say the AI streamlines hospital operations through predictive analytics for patient admissions, resource allocation, staff scheduling, enhancing overall efficiency and patient care. I'll say a very classical example. You would have all seen this use case where the duty doctors will come, they will get the file and they will check, right? What was the report or what was the observations made by the doctor who came in the previous visit. All these things could be automated. All these things could be captured. You all know, being IT or computer science or being a technical professional, you all know the value of data. Whenever we are able to gather the data, whenever we are able to hold the data, it makes easier for us to venture into the predictions, venture into the new analysis. So observation, what we make in a paper, if we are able to digitize that, it could be a wonderful feeding ground for predictions. We know a patient A with the parameters, with the pattern of parameters, if they have been affected by some emergency situation on the next day, then whenever we come across the same pattern, same age group, same kind of data, we could be careful and we could also even be alert and give them we can also prescribe them some preventive medicines. So to that extent, it could play a vital role. And prioritization of room allocation, prioritization of bed allocation, and kind of a matchmaking with the doctors for, which doctor can handle this, or which doctor has a good history of treating people with such kind of illness or such level of illness. All those things could be done by using AI. Resource optimization, this is what I'm saying. See, leave out, we have been always discussing, or the examples what we are discussing, it all happens after a disease has occurred. Imagine if a particular hospital or a particular organization is able to uh, foresee or anticipate a new outburst of a virus or a bacteria or a disease based on seasonal or a not non-seasonal one. It also helps them to equip their resources in a better way so that they'll be in a good position to cater to the needs of the patients, right? See, they can stock their medicines, they can keep stock of the equipments which may be required in that particular scenario, and they could also see to that they keep the availability of the beds on time. So these are all few measures or few steps which a hospital can take, and it can gear up for the nearby pandemic or a nearby outbreak of a virus. Lot of patient-centric applications. If you look at the patient-centric applications, a lot of health apps have come into the market. They provide them with the personalized health insights, fitness tracking, symptom checkers, empowering individuals to manage their health proactively. There are some apps which could, that's what I already discussed, which could measure the steps counter, which could measure how well you have slept, how many hours you have slept, what quality of sleep you had on a particular week or a particular month. All these things it can track. It can also even track what are the intervals in which you have consumed your water, what is the type of food you have taken on that particular day. Imagine you are in a recovery phase. If someone is in a recovery phase, whether they have taken up the tablets on time, whether they are having their diet which was subscribed or which was prescribed by the nutrition of that particular patient. All these things could be done by using health apps. Lot of health apps are available in the market. We have to be careful in using them in a right way. Virtual health assistants, which offer 24/7 support for managing medications, scheduling appointments, and providing timely health information, improving patient engagement. So this is one place where I believe the OpenAI will have a huge role to play. When I said about personalized assistant, imagine you have a virtual health assistant. Yes, I too understand, but when I talk about AI agents, yeah, your visiting hospital itself could develop a AI agent. They may develop an AI agent, they may give it to you. If that's the case, for a periodical checkup or whenever you have a doubt, whenever you wanted to clarify certain things, you could also do it with your virtual health assistant itself. For every time, you need not to go and stand in a queue, and you need not to commute yourself to the hospital. Wherever there is a very basic necessity need, or whenever there is a basic doubt, you can clarify all those things by using this virtual health assistants. Benefits: early disease detection. That is what we have been talking about. It will help us to detect the diseases early so that we will be able to check. So we will be able to check, like, I was checking whether is there any questions was there. So we will be able to have early detection of disease, enhanced treatment precision, that also we discussed, personalized treatment plans based on the patient data. How can we increase the medical intervention which could result in speedy recovery? These are all the things which could be a outcome of this by deploying this AI and ML algorithms. Reduced operational cost, automation of administrative tasks. I'm talking in perspective of a healthcare institution. Significant cost savings in healthcare settings, smart resource allocation, use of medical equipments and staff, minimizing waste and enhancing overall efficiency. We have seen, see, when I say reduced human resource, it doesn't mean that we will be replacing all doctors by AI or computers. No. The point here is there are few mundane tasks which could be solved or which could be carried out by a robos, or which could be carried out by a self-assistant. In such scenario, we can optimize the resources by deploying those kind of devices.
Sir, few questions were in the chat box, sir.
Okay, madam, I'll check it out. So this is you are talking about designing of new activation functions for deep learning. We will talk about that because it's out of our scope. But okay, I'll talk. There is no best AI technique. That's again, if I say that this is the method which is detects the AI better, no, that is not going to solve us it's not going to give us the answer. Um, I would say like, see, however we advocate AI techniques, still we need to rely on the doctor's advice for diagnosing a disease at least. Okay, see, AI could come into picture. AI could also play a role, but I cannot directly say that this method is the one which detects the cancer for better than any doctor. So we are not talking about doctors here. Maybe we can compare different systems which are available in the, see, CNNs. Normally CNN can be used as a algorithm for handling the X-rays or CT scans. In general, the if you have seen, Google has a product called Lina. Okay, it's called Lina. Lina is based on CNN. If you are happen to use Lina, is very commonly used in collaboration with CNN for detecting cancers. And SVM, of late, SVM is also used. And I mean, we are talking about the GANs. Undoubtedly, GANs play a vital role. GAN could also be an important candidate. And again, if I want to say, again, I would like to revert my previous example, like IBM Watson's oncology, and it also helps in personalized medicine. And you have Google DeepMind for breast cancer. Google DeepMind seems to be better. Okay, when oncologists, they rely on Google DeepMind, particularly when it comes to breast cancer. There is one more method called Path AI. That is also a good method for analyzing the cancer. So this question, new activation function for deep learning. Okay, I'll come to it later, because activation function, what I really don't understand, and what do you mean by new activation function? Okay, we will discuss at the last. I'll finish this and come. So this we have seen accelerating clinical trials. What are the enhanced research capabilities? So how can we accelerate the clinical trials? Right, the patient recruitment rate, I mean, starting from the patient's diagnosis to his recovery, we need to do a lot of clinical trials. Is there any way we can speed up the clinical trials so that we can start the treatment faster? That is one important area where we can look in. And another important 1 minute. So big data analytics, advanced analytics process. See, you know what is big data. So we'll be using enormous data set, which will give us huge data patterns and correlations, which will drive innovative research and medical breakthroughs. Okay. So big data analytics is, again, that's what in the beginning of my lecture itself, I started that we are in a stage where we need to contribute data to the medical research. Okay, so that we need to actually consider. Future directions, data privacy. Okay, I have spoken a lot about how data could play a vital role in leveraging AI and ML. But what are the leakages available in this process? What about data privacy? How how will we ensure that privacy is maintained? Whenever we are talking about a research, open data research, we should also at the same time ensure that the data privacy is maintained. So ensuring the confidentiality and security of data plays a very, very vital role, particularly when we are talking about clinical data, right? Imagine like I wanted to get the images of I mean, cancer affected patients. What happens if I tend to get with their name, gender, age, address? So that's the intrusion of their privacy, right? So how aware are we about using those medical data by duly protecting the privacy? A lot of bills have been passed in this regard. Europe has a GDPR bill, whereas India has also passed a data privacy bill, which enable each and every citizen that if they feel like their data has been breached, they can go to the court. And regulatory complaints. Whenever we talk about this healthcare related data, we should also be aware of different countries' regulatory compliances, because the regulatory complaints, there is no one regulatory compliance which matches all countries. Even for your information, if you are planning to come up with a new medical device, whenever you say you are capturing a data from the human body, you have to get approval from CDSCO, which is there in the Hyderabad. Okay, that is a central government device section, which will look into your idea, which will say whether it is permissible for you to use the device to capture the data from the human being, right? So these are all certain regulations or certain constraints which we need to look at. Technological innovation. When it comes to technological innovation, how can we integrate AI with IoT? See, the classical examples, whatever we discussed so far, starting from a smartwatch, starting from a smart ring, starting from a smart jewel, starting from a smart shoe, starting from a smart shirt, smart belt, smart dress, wearable technologies, all those things are standing example of how AI can integrate with IoT, right? There is no doubt about it. And you all know sensors have started playing a very important role in data capturing, which in turn helps us to maximize the work what we tend to do in the vertical of healthcare. It also does help in other verticals. Since this talk is about healthcare, I'm restricting myself to healthcare. And just now I listed GAN algorithms are there, CNN, RNN, and we are talking about transfer learning methods. So these are all some advanced deep learning techniques which could also be used for understanding. See, there was one case where I heard like whenever people speak to the helpline, based on their voice clarity, based on the kind of words what they use, based on the tone of their voice, there was one system, one software which could predict whether a particular person will commit a suicide or not. So these kind of voice speech processing or voice processing is also in place. So think about it. So tomorrow, uh, as we wear our spectacles, we may have sensors attached in our spectacle, which could also read our EEG signals, and it could also send it to the concerned caretaker, right? We are not far away from those days, you know. Future research areas, you can look at AI-driven genomics. Genomics is a wonderful area where it's a right time you can get into it. See, most of the Western companies, they are into this genomics. A lot of breakthroughs are happening in the genetic diseases, and they are trying to find out target treatments. Real-time health monitoring, though it seems to be insane and very naive technique, still real-time health monitoring plays a very vital role. Remote and real-time. Now they are trying to combine RR, remote and real-time health monitoring. Precision medicine, applying data-driven approaches to tailor-made treatments for individual patients and so on. So these, you can look at how AI software that writes software. Digital health data, we use an algorithm to develop, and by using an AI model, we are developing it. And once it's done, it is deployed. It could be used in the different verticals of medical, healthcare, like radiology, pathology, surgical, patient monitoring, genomics, decision support. So this is a dashboard of how a typical software could be built. I have taken this image from NVIDIA. This is again NVIDIA Clara, the computational platform for healthcare. For say, I take this picture only illustrates about NVIDIA. NVIDIA alone has such kind of support. It has Clara, Parabricks. Clara is the tag word which they have given for their healthcare initiatives. Clara, Parabricks, which talks about genomic. You can see here Clara NLP, which is NLP, which will be used as a tool to diagnose healthcare or any other emotional imbalance. Clara Imaging, Clara AGX, Clara Guardian, and Clara Discovery. So these are all few initiatives of NVIDIA where they try to penetrate into each and every section of the healthcare application so that they can become a comprehensive player to cater to any need which arise out of this healthcare application. Some more. AI-powered drug delivery. AlphaFold, it's a DeepMind extension of DeepMind. They solved a 50-year-old protein folding problem, enabling faster drug target identification. In silico medicine, the AI discovered a new drug for fibrosis, reducing the time to less than 18 months. You know, fibrosis is, they say it's not treatable. They can only keep it in the same stage. So there was one AI model which could solve the problem. Predictive analysis. You can see EHR, electronic health records. India, we call it as EMR, electronic medical records. They predict diseases before the symptoms appear. Got it? So we were talking only about, can we predict the disease early by capturing the symptom? There are few systems in place which could also find the disease even before any symptom occurs. Okay. Sepsis prediction. John Hopkins Medicine predicts sepsis in 4 to 6 hours. Google Health predicts diabetic retinopathy. See, this Google Health diabetic retinopathy is being even used in Indian villages, and it also checks cardiovascular risk using retinal scan. That was also a very breakthrough idea, because by looking at the retinal scan, we were able to find out what are the cardiovascular problem which a patient may go through. Personalized medicine. Tempus uses genomic data and clinical information to create personalized cancer treatment plans. And GRAIL, an AI-driven blood test, detects 50 type of cancers at early stage. When I say early stage, they would have not even thought about it. Okay. Diagnostics, Path AI, I already mentioned about that. See, I don't know. There seems to be a trend where most of the AI applications or most of the AI solutions were targeted towards cancer or oncology. Probably the natural evolution may be, since oncology detection happens through image, probably the technocrats may believe that AI could be a good player in analyzing or capturing the image and making some prediction out of it. Query.ai, it analyzes chest X-ray and the head CT scans for tuberculosis. Even tuberculosis, though we claim that in India we have killed it, there are few countries, still TB is a huge problem. And remote monitoring, I said about remote monitoring, you see Apple Watch and Fitbit, it's a classical example. Babylon Health combines AI with telemedicine to provide virtual consultations, especially in undeserved areas. See, even Indian government and Tamil Nadu government, they all come up, they have come up with this remote AI consultations, wherein they cannot do any surgical interventions, but they can perform up to diagnosis. A person residing in a small village in a deep south of Tamil Nadu can consult a doctor in a Madras Medical Mission through a telemedicine method or remote intervention method. So these are all some advancements which are happening. Da Vinci surgical system, they assist surgeons. It's not something that robotics only does the surgery. They also keep assisting the surgeons so that surgeons can rely on them without any further due. Microsoft HoloLens combines augmented reality and AI to assist surgeons with real-time imaging. That's what I already said. These kind of technologies, the combination of technologies could be used in getting the expertise. Probably that expertise may not be available in the near geographical location, but still he can supervise the entire surgical process and he can pass his comments. Mental health interventions, Wobot and Visa, AI-powered mental health chatbots, which provide CBT-based therapy to users, and a lot of apps or lot of chatbots have come in this area. LE, a virtual therapist using facial expression to analyze and detect mental health conditions. See, once you need not to feed anything, you just need to show your face. Once it detects your face, it understands what emotion are you going through, what is the state of your emotion, do you need any intervention, do you need any medication? All such things can be calculated by LE. AI-driven pandemic response, Blue Dot, predicted the COVID-19 outbreak by analyzing the global data sources before official announcements. My dear friends, this is what we have to look at. There are systems which could be a pioneer and which could also hint us even before any damage is caused. We have to observe and we have to follow them. DeepMind, SARS-CoV-2, CoV-2 aiding vaccine development. So DeepMind was used for developing the understanding the RNA and DNA structure of that COVID virus so that we were able to come up successfully with some countermeasure or medicine during that period. AI in genomics, Helix and 23 and me, it uses genomic data, gene therapy. Uh, there are a lot of companies, even there are startups in Tamil Nadu who work on this gene data. Arteries, Olive AI, these are all some uh, AI related solutions which play a vital role in operational efficiency. Future directions. I see, I think you all would have heard about this Neuralink, right? He has successfully implanted a device into a human brain and he is capturing the signal. That's something which is very really fascinating. We don't know where it is going to take us. Digital twins. Probably you would have heard about this digital twin. What we can do is you can create a digital twin of your patient, and you can feed medicines virtually so that even before you try some medicines with the real patient, you can test it with your digital twin. Okay, that is the beauty of this digital twin. So holographic AI assistants, where the holographic AI assistants will assist the doctors in that's not future, that's already happening. We also talked about data security. Blockchain could be a player where we may leverage blockchain to protect the data. Thanks. And do you have any questions? I'm open for questions. And 1 minute.
So data privacy can be achieved by federated learning. The
See,
question
data
is,
privacy can also be achieved by using federated learning. I won't say like data privacy, federated learning is one scheme where we achieve privacy. I don't deny it, but there are other than federated learning which we need to think of. We need to see how we can achieve privacy, madam.
one more question from participant side. The recent research topics are area in psychology of adolescence and child.
Mm. Can you guide about the recent research topics again? Psychology of see, there are two things which always happens in the psychology. Even today, people say there are UN certified questionnaires which we need to use to analyze the psychology of the human being. I need not to mention You can talk to any psychologist. I have personally worked on a project where they gave us a UN selected questions which we used for understanding the psychology of the human being. So that is one place where we can use, but we are coming to a stage where, see, by measuring your EEG signal, the brain EEG signal will give you at once per second, it will give you 8 datas. That is alpha, beta, gamma waves, which is part of the brain. Further is divided into 8 different waves: high alpha, mid alpha, low gamma, low alpha. Likewise, there will be 8 waves. We capture all the data by using a mere sensor, and we will be able to understand what is that the currently the adolescent or the kid is going through. Those kind of things have started happening, but when it comes to human being and psychology, yes, AI algorithms could play a very, very important role. Any other question?
Participants, you can post your questions. Do you have any other questions?
I'll check. Is there any questions?
Yeah, there are no more questions, sir. Thank you so much for the sessions and sharing the valuable
I
inputs
think
to
there
us.
was one question which a person asked about activation function.
Yes, yes,
Yeah.
sir.
Yeah, along, yes, sir.
Activation function, see, there are many type of new activation functions. As far as I know, there is a MISH formula, there is a Swish, MISH and Swiss, and you have what is that Gaussian error linear unit formulae, and you have sine and LU, max out. See, lot of formulas or activation functions are coming up. So, but what I suggest is you have to look into the context in which you are handling. For say, if you are into some, see, you have to decide when it comes to healthcare applications. I'm restricting my answer to only healthcare applications. When it comes to healthcare applications, you have to be like, what are the recent activation functions they have used and how you can leverage that. And another important area which I missed in the talk is personalized LLM and SLM for individuals. Okay.
Sir,
So
few more questions also there. What is the use of softmax activation function at last layer?
see, I think it's too technical question. I'm skipping them because it's all about deep learning network. So each and every, if I start talking about activation functions, there are more than 10, around 10 activation functions are there. So I'm not getting into it. When it comes to privacy preservation, I would say like very basic thing, we call it as PII, removal of PII, personally identifiable information. So that need to be removed. Okay. So that need to be removed, and anonymity need to be maintained. So these are all some areas which we need to look at. And federated learning is also coming up, and it could also be a good candidate for preserving the privacy. Any other question, madam? See, when federated learning,
I
when we talk about just one information, when we talk about federated learning, the problem is the healthcare industries in India are, to be very blunt, hospitals in India should come together. Then only we will be really able to generate the federated learning concept, right? Otherwise, it's not going to work out. If you look at USA, they have HIPAA. They call it as HIPAA, where it is GDPR in Europe, and we call it as
Continuing to this results, we have concluded like Embroidery had a better results when compared to
Is it DC2?
DC2 when compared to the
Can you mute yourself, sir?
like on the interlacing of
kindly
lines,
mute yourself,
structure of the
Okay, so
Yes, I self I muted, sir.
so so what I have seen is Google's TensorFlow. TensorFlow supports TensorFlow, there is a concept called Google TensorFlow Federated, which supports differential privacy. We can also get into it, but that also takes some time. How can we use this federated learning across Indian applications? We have to wait and see. And if I'm right, Google is already into it, and Microsoft is also working on leveraging federated learning to come up with protecting the patient data. Google and Microsoft are into it. Okay, if there is no more queries, thank you so much for the opportunity, and I hope, as I said earlier, this is only a curtain raiser session. I know I have not dealt any particular use case, because I thought I'll give you the overview of what is the status of AI, and the topic given to me, I have to restrict myself only to ML. So that's why I have sticked on to the limit, and I have only discussed about ML. Otherwise, you can also look at transfer learning. Transfer learning is also a wonderful tool where it could also solve many of our problems. It could also be a good player. Thank you.
Chitra ma'am. Sir, thank you, sir. Thanks for your wonderful session. Participants, please retain in the same link. The session 2 will be started within few minutes.
Thank you.